mast cell disease and mast cell related issues, it feels like they've become more prevalent in conversations around health and immunity and things like that. Has there been any changes just from your experience and people who are experiencing that, or is it that it's just getting diagnosed more accurately, more commonly?
I think we've learned a lot more about the immune system and the mast cell in particular. The mast cell is a very interesting cell because it's also a cell that regulates what we call innate immunity and also acquired immunity. So it really is a cross between those two, and it's also a cross between the nervous system. It's a neuroimmune cell and the immune system. So it's a very fascinating cell, which we're learning a lot more about.
When I think about this, anything dealing with immunity, anything dealing with neurology, the first thing that comes to my mind is like what is happening in stress and mental health and the environment,
Hmm.
dietary,
That's right.
whatever is exacerbating that. Because when I see these conversations happening, I'm starting to see the body being talked about as more of like a whole ecosystem, right? So even when we talk about immune issues, right, there's papers that have come out that say like, inflammatory markers can migrate across cell membranes and things like that, maybe triggering inflammation in different parts of the body. And so
Right.
this idea of the body as a whole and leaning more towards maybe even translational medicine when we gather this information, I'm curious to know just when it comes to chronic hives, are there any insights on environmental, dietary, psychological things that might make them worse or even trigger them? Like, have you found patients saying, like, I went through this health event and then this happened, or, you know?
Well, as we know, stress can cause a lot of diseases, and it certainly can affect either directly or indirectly the mast cell, and that releases histamine. So, yes, stress can definitely be a releaser of these vasoactive substances that causes the wheals or the urticaria that we see. So, yes, stress is one thing. Diet, of course, is a big effect. As we know, there's a relationship between the gut and also the lungs and also the skin. So and the brain. So we have all these organ systems interacting. And so you can see how one organ system can affect another organ system.
Are there any comorbidities with things like this? One thing that comes to mind for me is people who are prone to things like oxidative stress, people who maybe are like have like neurodivergence, or they're you hear people who they've got the atopic triad, right? Eczema, atopic dermatitis, and asthma often go together. These are inflammatory things, right? So then I'm wondering, are there any other things that often come along with chronic hives?
Well, what we're most concerned about is angioedema, which is a more serious form, a deeper form, if you will, of urticaria, and of course anaphylaxis, which is a state where the body basically turns off. It turns down because there's a hypersensitivity that's affecting all the cells. So the mast cells all throughout the body start releasing histamine, and that's really a life-threatening situation.
Mm.
So we hope that we always hope that it never devolves into that situation, but anaphylaxis is a real thing.
When someone has something like chronic hives, and it goes undiagnosed for a long time, right? So maybe they're just like, this is just how my body is. People get used to living with certain things, even though um, if they don't go into something as extreme as anaphylaxis, what's the impact of chronic long-term mast cell activation on the rest of the body?
Well, first of all, it's a miserable existence. I mean, nobody wants to have blotches all over their body and also the itch that comes with it. It's really distressing. It affects your sleep, your ability to work and function. So it's very important to get this disease under control, this condition under control.
Does it impact eventually any of the other organs, or are there any kind of does the chronic histamine release lead to any other things that you know might not have been present before?
Well, histamine receptors are all throughout the body. They're in the GI tract. So yes, could you develop diarrhea? Could it cause bronchospasm in the lungs? Could it stimulate the brain? Certainly sensory nerves. So yes, all those are connected because all those cells in those different areas have histamine
Mhm.
receptors.
So let's talk a little bit about diagnostics. What essential elements should a diagnostic workup include to confirm chronic spontaneous urticaria and exclude other causes?
The most important thing is the history in the physical exam, the history in particular, because you want to figure out how often the hives are presenting themselves. You also want to know how long they last. Because if a hive lasts longer than 24 hours, we also have to think about more serious conditions like vasculitis. And vasculitis can be related to autoimmune diseases such as lupus, for instance. So that's something that's very important to distinguish. But to better define which type of chronic urticaria, we can do some blood tests. We can look for IgE levels. If they're elevated, that points more to the autoallergy type of urticaria. If IgG levels are elevated, then we think more of the other type of disease. The most common type of spontaneous urticaria, chronic spontaneous urticaria, is the autoallergy type, and that's probably accounts for 70% of the cases that we see. So there are some diagnostic markers that we can look for in the blood. We also get an ANA if we think there might be an autoimmune function. We also do a CBC. We may check a CRP and a SED rate to see if there's inflammation in the system. Sometimes we also check thyroid antibodies because thyroid disease can also trigger urticaria.